Hello, everyone. Welcome to the Glow Podcast. I am here today with a very exciting guest. I have Jen Kirkham from Rebis with me, and I'm super excited to talk with her. But for those of you who are new here, we are Tailored Marketing, and we help health, wellness, and longevity businesses grow through strategic marketing and sales strategies. So if you are interested, drop a comment below. Jen, thank you so much for coming on today. I'm super excited to speak with you. If you would, I would love if you would just go ahead and give a little bit of an introduction so the listeners know who you are.
Great. Thanks, Taylor. It's an honor to be here, and I'm so glad that you picked me to talk together today. It's definitely something that I love to do. My name is Jen Kirkham. I am the Vice President of Clinical Operations here at Rebis Health. We have 4 locations within the Denver metro area, but my roots are actually in the Boise, Idaho area. My background is in functional health and wellness as actually a functional dental hygienist, and then went into clinical practice around heart attack and stroke prevention, Alzheimer's reversal and treatment, and even airway and sleep health. So here at Rebis, the world is my oyster is how I feel because of the amazing things that we're doing here at Rebis Health. So thank you for having me.
Yeah, no, I'm so excited to have you. I feel like you bring such like an interesting and cool perspective. And so, yeah, no, I'm super happy to have you on. So I would love to, for the listeners who maybe aren't familiar, for you to just kind of tell us like a little bit more about Rebis and what you all are currently working on over there and how you are helping all of your patients.
Great. Yeah. Thanks for that opportunity of how we're helping our patients. Here at Rebis Health, we're a multi-specialty clinic, and it's a novel center of excellence that has national representation of literally the best in the country are here, which is actually really humbling because, everyone has their moments of imposter syndrome. They're like, oh my gosh, pinch me. Is this for real?
Yeah.
A lot of people come to Rebis because they're not sleeping well. They're told by their provider, be like, hey, well, you should really look into see if you have sleep apnea. And that can be kind of a scary word for some people, but it's something that we see more often than people realize. And it's not so scary when you approach it in the right way, which is what we do in a very empowering way. We treat anywhere, kids, babies, with feeding issues and breathing issues, and babies go hand in hand. So we have nationally recognized providers that are trained to treat from birth all the way up to the 90s.
Yeah, wow, that's super cool. Yeah, I didn't realize too that you all worked like you said with literally babies all the way up to 90. So that's such a cool thing to be able to help literally like anyone who's having those kinds of issues. And so I know you said obviously you all have nationally recognized providers over there, which is super, super cool. And I mean, it definitely is like a niche, like with the sleep and everything. I feel like sleep is obviously important for everybody, but it's such like a niche thing. So that's also really, really cool that you have such a specialty. But besides that, what you talked a little bit about kind of the empowerment piece as well. And so can you talk like a little bit more to the process of how you all work with patients and how it is maybe different from other practices that people would go and see practitioners at?
Yeah, I think the easiest way to explain it is probably referring to experience that we've all had when you go into a certain doctor's office and you have a limited time with the doctor or your provider. And like once you arrive at a decision, it's like, therefore you have this label on you. And it's like, oh, hi, I'm Jen. It's almost like I had asthma when I was a kid. It's almost like saying, hi, I'm Jen and I'm asthma.
Yeah.
Therefore I can't do this, or I'm on medications for a long period of time. And the reality is that our bodies are connected and our health systems aren't separate. And so that's what we're bringing together at Rebis is through this empowerment process. We look at the body as a whole system and looking at how are the systems working together or working against each other. And one symptom that someone might be having is poor sleep.
Yeah.
But there might be some other reason why. And so our whole empowerment piece is that we're trying to help people get better as quickly as possible to thrive at life, to thrive during the day. I'm a mom of three, and I can remember those sleepless nights. And I don't
Yeah.
know about you, but I was grumpy. I had brain fog. I was like, I just wasn't at my best.
Yeah. When you're not sleeping, it's the worst, literally.
Yeah, yeah, and it is the worst, but it's also like a symptom.
Yeah.
And so we can't separate sleep from looking at the rest of our body systems. And so in our empowerment process, we actually have a three-part process to our appointments, and they're called Awaken because we're waking up to, we're awake, but we're awake to our body as a whole. And we have this provider who is a guide and like a partner in this process. And so we have a trust in that partner, a trust in that guide. And that guide is going to be an advocate and gather as much information as possible about us as an individual. So we call it a narrative. That's what's called a narrative-based medicine, rather than a label. Hi, I'm asthma.
Yeah.
It's like here's the person as a whole, and it's done through a 5-part process that all of our providers are trained on. So this Awaken visit is all about telling your story and telling what's happening in your life. I mean, Taylor, could you imagine going into a provider? How would you feel if this provider said, tell me what's your story, and just sat and listened? I mean,
Yeah, that would be pretty awesome because I do feel like, I'm sure everyone kind of feels this way when you go and see a lot of your practitioners now, you can almost feel that they just want to, not everyone, obviously, but you can
sure.
kind of feel that like they're like just trying to talk to you real quick, like 5, maybe 10 minutes, get you out of there. And like, all right, here's your antibiotics, or here's this diagnosis, and it's not really, okay, so tell me what's been going on, like, have you been under stress? Has there been any major life changes? Or like, just like you said, even tell me your story, like, because that's almost more empowering than even asking questions, because it's just like, okay, I want to hear what you have to say.
Yeah, poor sleep doesn't just happen one and done. Like
Yeah.
sometimes we learn how to suffer, to be quite honest, right?
Yeah.
Yeah. So that's like the core first step of empowerment. Another really cool element is what we call the core assessment, that it's a half step after this empower experience. Because we want to be in partnership with our providers, have a guide. Our guide, I don't know if you've ever been scuba diving, but
I
I always went
haven't.
with a guide because like going in a lava tube, I didn't want to go into a dead end and be out of air,
Yeah.
right? And there's so many different levels of training that my guide would have that wouldn't lead me astray, because the consequences could be very expensive, but also clearly detrimental, right?
Yeah, for sure.
So, same thing here. In the Awaken visit, your guide collects the narrative, and then our core assessment hits 4 key foundational pieces so that your guide has all the information that can be presented in a format that helps you make a decision together with your partner provider. And so,
Yeah.
those 4 key assessments include a full head and neck anatomy assessment, because what's the key to good sleep? Good breathing. So, we got to look at the anatomy, and then we'll give you a sleep study. We can do it as easy as sticking a ring on your finger. I
Yeah.
love technology. Ring on your finger and tell us, like, what's the body systems doing while you're sleeping, right? And then we do other anatomy and functional assessments that may include some blood work to say, are your body systems struggling? Because I don't know, Taylor, if you think about, let's just think critically here. If you have sleep apnea, which is stopping breathing while sleeping, breathing disturbance, what body system is not touched? What'd you say?
Is not touched by that.
Mm-hmm.
I don't know. Maybe like your muscles. But I feel like your muscles are a part of it. I don't think there's any system that's probably not touched by it.
You're right.
Yeah.
That's right. Yeah, and how we measure like that burden, not to put you on the spot. Sorry, Taylor. Like,
No, you're fine. No, I love it. I love questions.
oh, good. Well, we can measure like a burden on our systems.
Yeah.
by certain blood work markers. And so those four key items, the anatomy of the head and neck, a sleep study, blood work, and then, believe it or not, I don't know if you know the science behind nasal breathing, but ever since James Nestor came out with his book Breath, it's just taken it by storm, where it's become mainstream that we all know that we're calm and collected and relaxed when we can put our tongue up to the roof of our mouth and simply breathe through our nose, right? So we look at the nose function. So between those four things, then we can look at the body as a whole and then connect it to that story that you have going on. And most of the time, you've been living with that story for a long time, because we all learn how to suffer.
Yeah.
So the goal at Rebis is to get you on a healing path, a treatment path, as quickly as possible for the sake of feeling better, not just to give you a label, give you a pill, give you a doodad to do,
Yeah.
It's not about that at all. It's looking at the body systems, looking at your body as a whole, and then make a decision together. So our third and final step is called the Empower Visit. Imagine that.
Yeah.
So our medical providers and guides get to act as an advocate for you, and through simplicity, give you a reasonable level of success. Which treatment would be most successful, and what would the outcome be? So we break it down into those three parts.
That's super, super cool. And I love too, I remember when we spoke for the first time, you said kind of like, it's when you go to that Empower Visit, you're giving them the knowledge of like what's going on and everything and treatment options, but ultimately like you're kind of making a decision, which like it doesn't always feel like that in health wellness like situations. Sometimes you feel like the provider's basically just like, okay, this is what you're gonna do, and like, you're not really given different options of like, okay, we could potentially try this or we can try this, but like you're given the knowledge and then the options for what is going to give you the best outcome.
Yeah.
Yeah.
Exactly.
Yeah.
Yeah. And, we live in a world and a time where we can go and Google and search just about anything. And even, just looking into hormone replacement therapy, we do that here, by the way, because
Okay.
when someone is sleep deprived and has struggles with their sleep, chances are that that's one of the things that come down to is hormone levels.
That makes sense.
So, yeah. But one of the things I do want to emphasize is that people are looking for treatment before they're looking for the big picture. And there is some danger in that. I've known guys who have gotten easy access to testosterone and had like cluster mini strokes.
Wow.
So they're like, this is the most cost effective, time efficient, and an emotionally safe way to get yourself feeling better.
Yeah.
And luckily, our providers are like, we have multi-specialties. And so if one provider that you're meeting with, they can reach out, it's like phone a friend.
Yeah.
And you have access to literally like leading experts in all
Every
areas of
field.
health.
Yeah.
I don't know who wouldn't want that and
Yeah.
do that four-corner assessment and then have access to national leaders and know that the decision that you're making is, number one, safe and effective.
Yeah.
I think that's something that's really important to mention, because the cost of doing it backwards can actually be, the consequences can be very steep.
Yeah. I was going to say it can be very detrimental. And it is like, that's such a good point too. We have so much access to information. I mean, you can just go on ChatGPT and be like, okay, I'm not sleeping well at night. Like I'm presenting with these symptoms, and it'll give you probably like, oh, okay, these are some different options for what you can do. And it seems quick and easy in the moment, but a lot, like you said, it's not a real accurate view of what's actually going on in your body. Like you have no idea. You haven't talked to anyone. You haven't done any studies. Like it's just kind of anecdotal. Like it's not real. Everybody's different, and everybody's body is different, and you all are obviously taking that into account to like the fullest level and ChatGPT or Google, our two friends, they're not taking any of that into account.
Yeah. Yeah, I hear you. I hear you.
Yeah, they're giving everybody just kind of like the same basic information, and it's like that could easily not be what the issue is.
Yeah. And the cool thing is that you should use those resources for where it's appropriate.
Yeah.
If you want support in creating a diet and a daily routine that's going to be supportive of your very specific lab results, that's totally great. But remember, don't forget that after we go through the empowerment visit and you go through a healing treatment pathway, you come back and you reassess.
Yeah.
It's so important there, and we make it as easy as possible.
That's super, super awesome. And so for you all, like, what are you guys kind of focused on, like, over the next, like, year, 5 years? Like, what are kind of some goals besides helping patients? Are you guys looking at expansion, or what does that kind of look like?
Yeah, we have expanded to areas where people have been asking for help.
Yeah.
Right? So our two core locations, or three really, Longmont is an area that we serve, the Boulder population and surrounding areas, Westminster into that metro area. We have a location in Parker, which, by the way, announcing that we're moving to Lone Tree actually next week. So that'd
That's
be great
awesome.
to blast there. So I think they're like doing the rest of the moving pieces this weekend.
Wow.
It's a beautiful space. And then we also serve the mountain community up in Frisco.
Okay, super cool. Yeah, that's awesome. Do y'all have like any goals that you're kind of like working towards, like I said, besides helping patients, or is it just continuing really to just bring more patients in and like up the awareness about Rebis and what you all are doing?
Yeah, I think it definitely does start with awareness and education.
Yeah,
So on our roadmap, we're definitely going to have open houses for our referring other healthcare providers because we are a highly collaborative community as well.
that's
We work
awesome.
with so many different specialties and we don't have to do it all, but we do have the ability to see the big picture and can help connect the dots for patients in a collaborative way.
Yeah,
And just me personally, I got into this because I couldn't get my family care and I had to literally craft the pathway, the clinical pathway and the workflow so that I didn't have to worry about losing my daughter, which we almost did because of an airway and sleep issue. So I'm speaking from experience and I am coming out with, I have a couple chapters written of a book. I put it in
wow.
audio form. It's so scary to say that, just because it's very personal and it was such an emotional roller coaster in that I want to be that like another voice of support for parents who deep down intuitively be like something's not quite right here, and that's for the kids that are diagnosed with ADD, ADHD. 60% of kids medicated for ADD and ADHD don't have to be. And do you know what those drugs are? It's like a variant of
Very
methamphetamine.
crazy. Yeah, no, it's insane.
And the consequences, I'm telling you, they're steep. So if
Yeah,
we can prevent kids from getting medicated and address the reason why it's happening, it's always airway and sleep. If you address that, addressing the airway and sleep the way that we do, it's about brain development.
yeah,
So I saw it with my own kids. So we're going to have community workshops, open houses for providers. And you're right, Taylor, it's about building awareness. It's
yeah,
it's about educating our fellow providers and the public that like you don't have to suffer. Like you don't have to anymore.
yeah.
You really don't.
That's so cool. Yeah, wow. And I mean, I can tell why you're so passionate about it now. I mean, it makes sense. I'm so sorry that that happened, but like, it kind of sometimes things have like a weird way of like guiding you towards what you're meant to do. And now you're helping other people with this and like bringing awareness to it, like you said. So, like, there's like, I mean, like I said, I'm so sorry that that happened, but like it kind of did show you your path and like your passion and what you're meant to do too.
Yeah, thank you for that. And I've had to do the emotional wrestling as a
Yeah,
mom, like come
of
come to
course.
terms like, oh my gosh, I didn't do enough, I didn't know enough. And that's just not it's not they're not empowering thoughts. And I think it comes in waves. I have ups and downs of looking at pictures in the past. It's a little painful.
Yeah.
But I'm not sorry that I went through all of that. And it was such a blessing. And there's really something to be said about our life experiences. And if we just open our eyes to being aware of what's out there and what we're able to take initiative and do, it is so worth it. Now I have a thriving 19-year-old who
It's
is in
awesome.
college, and she's healthy and thrived at lacrosse. And all
Yeah.
three of my kids had breathing and sleep issues, by the way.
Wow.
All showed up differently. And if I didn't know those four, foundational pieces that we're integrating with Rebis, I would have missed it.
Yeah.
And it, my son is thriving, my daughter's thriving. And I know I've seen, because I've worked in clinical care, I've seen the consequences of inaction.
Yeah.
And not that I like want to poke any fear, but like it's a real thing that those who are suffering as adults and kids from anxiety, ADD, ADHD, depression, heart issues, Alzheimer's is on the rise. Like it's a real thing. And I don't it's hard not to get emotional when you think about the consequence of inaction.
Yeah.
So if I could have any plea to any mother or parent, like treat yourself, treat your kids, treat the kids and the lives around you. And the rewards, the process, it's priceless. It's
Yeah.
priceless, Taylor.
That's so awesome. I love that you've like found your passion. And honestly, it is so wild to me like the more that you look into just about anything that you're going through, whether that's like anxiety, like it could be mental or it could be physical things, like almost all of it is related to sleep. And people know, I feel like majority of people now know that sleep is so important, but it's still not talked about enough, like just how important it is and how important like good quality sleep is too, because there's a difference between you sleeping and like you said, blocked airways, like there's all these things that could be going wrong when you're sleeping and you have no idea. So it kind of shows you just how important it really is.
Yeah. If you could experience snorkeling, but instead of using a big fat snorkel, just go use a straw instead and just picture what that would look like. And I think anybody would have anxiety.
Yeah, literally. That is so true. That would definitely give me anxiety. Or like you were talking about earlier with scuba diving, like, trying to breathe through something that's like so small too with that, like that would be terrifying. And like that's kind of what you're going through when you're sleeping if you're not don't have aren't able to breathe properly.
Mm-hmm. Yeah.
Well, cool. Well, I feel like this was such a great conversation. I would love for you to tell everyone where's the best place to find you, where's the best place to find Rebis. I will also include all of the links in the show notes too, so everyone has easy access to it.
Yeah, great. If you go to rebishealth.org, if there's a place that someone can say who sent you or who referred you, why don't we just put the Taylor Studio
Okay.
on there? I think that would be good. And because I also want to know, like, is what we're doing effective in building awareness? And so if you
Yeah.
heard this podcast, if you just go and make an appointment, or if you want to, even send me an email, jkirkham@rebishealth.org. I'm the VP of Clinical Operations, but I do check my email regularly, and I want to touch base with you if you think of there's a collaborative opportunity, or just have a personal question with moms, from a mom perspective.
Yeah.
Either myself or one of my team members will reach out to you.
Okay, I love that. That's awesome. Yeah, I'll include everything too. And thank you so much again for your time and coming on and educating us and helping us to learn more about Rebis as well. So I really appreciate it.
Thank you for giving me the opportunity.